In the last video, we talked about how rare anesthesia awareness really is. But that naturally raises a bigger question. If awareness is so rare, what keeps it rare? How does an anesthesiologist actually know how much anesthesia to give you? Because this isn't a cake recipe. It's not like pouring fixed amounts with measuring spoons. Every patient is different, every surgery is different, and the body is constantly changing during an operation. So how do we make sure we give you enough to keep you unconscious and pain-free without giving too much? Well, once you understand what we're monitoring and what clues we're looking for in a sleeping patient, anesthesia starts to feel far less mysterious. I've said this before, but it's important to understand that anesthesia is not a single medication. It's usually a combination of drugs, each doing something specific. One helps with unconsciousness, another one blocks pain, another one may relax muscles, and others help stabilize blood pressure and heart rate. Because these drugs affect different systems, they can each be adjusted independently, and that's important because it allows for precise control. Most people imagine anesthesia as something that's given once at the beginning of surgery and then left alone, but that's not really how it works. Anesthesia is adjusted continuously, minute by minute, sometimes second by second. Your heart rate, blood pressure, breathing, oxygen levels, carbon dioxide levels, body temperature, and other signals are being watched constantly. These aren't passive numbers, they're actively telling a story about what's happening inside your body through time. If your body shows signs of reacting to the stimulation from surgery, we can deepen the anesthesia to keep you comfortable. If your blood pressure drops too low or goes too high, we can make adjustments with different medications. It's continuous active management, not guesswork. So let's talk about what all these numbers on the anesthesia monitors mean. These numbers show the heart rate from 3 different sources, and this one shows the blood pressure. A sudden rise in either or both of these often indicate that the body is sensing stress or pain. This one shows the respiratory rate, and this waveform shows the breathing pattern. Those tend to change when sedation levels shift up or down. This number shows carbon dioxide levels, which reflect how well you're ventilating or exhaling waste CO2. In some cases, there are also brain activity monitors like this one, which can estimate depth of anesthesia using electrical signals from the brain. None of these numbers alone tells the whole story, but together they create a real-time picture of how your body and brain are responding to both the anesthesia and the surgery. I've talked to lots of people who aren't in medical fields about anesthesia, and the thing I hear people assume the most often is that anesthesia dosing is just based on your body weight. Well, weight matters, but that's only one factor. Your age matters, your medical conditions matter, the type of surgery you're having matters, the medications you take matter, whether or not you use drugs or alcohol matters, and lots of other things too. That's why anesthesia is tailored to each and every patient, not standardized. The goal is not to give the maximum amount. That can be dangerous. The goal is just to give the right amount for you. Now, one reason waking up during surgery is so rare is that anesthesia is not delivered at the edge of consciousness. Patients aren't kept right on the verge of waking up. There's a big safety margin between being fully unconscious and being aware, and that margin provides a lot of stability, so small changes during surgery don't suddenly bring someone back to consciousness. Anesthesia is not luck or instinct or gut feeling, and it's not just one dose of one drug given at the beginning and forgotten about. It's continuous monitoring, constant adjustment, and individualized care for every person because everyone's different. When people imagine waking up during surgery, they often imagine no one paying attention. But the reality is the opposite. The entire job of an anesthesia provider is paying attention. Now, at this point, you might be asking yourself, if the goal is to give just the right amount of anesthesia, then what actually happens if a patient gets too much? Does it cause brain damage? Does it destroy their liver? Can it be fatal? Well, in the next video, we're going to explore what excessive anesthesia does to the brain, the heart, and the rest of the body. And we'll also see how anesthesia providers recognize and correct it before it becomes dangerous. If you've ever wondered where the real safety limits are, that's exactly what we'll be looking at next. I'll see you there.